Did you know that prostate cancer is one of the most common types of cancer in men worldwide? Despite its prevalence, many men fail to recognize the subtle symptoms that could indicate the onset of the disease. Today, we will explore in detail the early warning signs that should never be ignored, the most significant risk factors contributing to prostate cancer, and key preventive measures every man should take. Stay with us until the end to gain vital knowledge about how to identify potential changes in your body and ensure timely and effective treatment if necessary. Understanding the prostate, its role and impact on health. The prostate is a small, walnut-shaped gland in the male reproductive system located just below the bladder and in front of the rectum. Although small in size, it plays a crucial role by producing part of the fluid that makes up semen, which helps nourish and protect sperm. Any imbalance in this gland, whether due to inflammation, e.g., prostatitis, or the emergence of abnormal cells, can lead to serious health issues. Prostate cancer occurs when prostate cells mutate and multiply uncontrollably, potentially forming a tumor. While it is often a slow-growing condition, certain forms can be aggressive and may spread to other parts of the body. Understanding the prostate's function and location is essential for recognizing early warning signs and seeking prompt medical attention. The importance of early detection. Early detection is the cornerstone of successful treatment for prostate cancer. Unfortunately, in its early stages, the disease may not cause obvious symptoms, leading many men to unknowingly live with the condition. This highlights the critical importance of routine screenings, such as PSA, prostate-specific antigen tests, and digital rectal exams. When diagnosed early, prostate cancer is not only more treatable but also less invasive to address. However, the stigma and fear surrounding procedures like the digital rectal exam deter many men from seeking evaluation. It is essential to prioritize health over social discomfort or cultural barriers. Early action can save lives. Key risk factors for prostate cancer. Several factors increase the risk of developing prostate cancer, including 1. Age. Men over 50 are at significantly higher risk, although early onset cases can occur. 2. Family history. A family history of prostate cancer, especially among first-degree relatives such as a father or brother, raises the risk considerably. 3rd race. African American men are statistically more likely to develop aggressive prostate cancer than men of other ethnicities. 4. Lifestyle choices. Diets high in animal fats, lack of physical activity, and obesity contribute to the development and progression of cancerous cells. To reduce these risks, maintaining a healthy lifestyle with balanced nutrition and regular exercise is highly recommended. Early symptoms that should not be ignored. 1. Changes in urination patterns. One of the earliest signs of prostate issues is a noticeable change in urinary flow. Symptoms include difficulty starting urination, a weaker or interrupted stream, and a persistent sensation of not being able to completely empty the bladder. While these signs are often associated with benign prostatic hyperplasia, BPH, a non-cancerous enlargement of the prostate, they can also indicate early-stage prostate cancer. If you notice any changes in your urinary habits, seek medical evaluation immediately for accurate diagnosis and effective treatment. 2. Increased nighttime urination frequency, nocturia. Waking up multiple times during the night to urinate is another symptom that is commonly dismissed as a normal part of aging. This condition, known as nocturia, can result from various causes, including prostate enlargement, infections, or poorly controlled diabetes. An enlarged prostate exerts pressure on the bladder, triggering frequent urges to urinate. Interrupted sleep from nocturia can lead to fatigue, irritability, and a reduced quality of life. If nocturia worsens or occurs alongside pain, burning, or other urinary symptoms, it is essential to seek medical advice. 3. Blood in urine or semen. The presence of blood in urine, hematuria, or semen, hemospermia, is an alarming symptom that should never be ignored. While these symptoms may be caused by conditions like urinary infections or kidney stones, they could also indicate the presence of tumor lesions in the prostate. Blood in bodily fluids often appears in more advanced stages of prostate cancer, but it is vital to address this symptom immediately, regardless of its cause. Diagnostic procedures such as imaging tests, lab analyses, and biopsies can help identify the source of the bleeding and determine the appropriate treatment. 4. Pelvic pain or discomfort. Pelvic pain is often associated with inflammation, muscle strain, or other benign conditions, but it's crucial to remember that the pelvic region contains multiple vital organs, including the prostate. Persistent feelings of heaviness, discomfort, or sharp pain in the lower abdomen, lower back, or genital area could indicate the growth of a tumor. This discomfort may sometimes radiate to the lower back, making everyday activities like walking, bending, or sitting for long periods challenging and uncomfortable. In advanced stages of prostate cancer, this pain may become chronic and harder to ignore. Unfortunately, many individuals mistake this symptom for muscular or inflammatory pain, delaying medical attention. Persistent pelvic or lower back pain should never be dismissed. It could be a sign of a serious underlying condition requiring immediate medical evaluation. 5. Changes in ejaculation. Prostate cancer directly impacts the gland's ability to produce seminal fluid, which plays a key role in sperm transport and nutrition. Men with this condition may notice a reduction in the volume of semen or experience pain during ejaculation. Such symptoms are often mistaken for temporary infections or benign conditions, leading to a delay in addressing the root cause. In some cases, tumor growth compresses nearby structures and ducts, causing changes in semen's texture, color, or quantity. If these changes persist for weeks or worsen over time, it's critical to seek a professional evaluation. Notably, many prostate cancer cases are identified at this stage, often before more obvious urinary symptoms appear, emphasizing the importance of paying attention to subtle changes in reproductive health. Difficulty maintaining an erection. Erectile function depends on several interconnected factors, including healthy blood vessels, an intact nervous system, and a properly functioning prostate gland. When prostate cancer develops, growing tumor cells may interfere with the blood flow necessary for erections, particularly by compressing the blood vessels supplying the penis corpora cavernosa. Although erectile dysfunction, ED, can arise from various causes, such as diabetes, circulatory problems, or medication side effects, sudden or progressively worsening erectile difficulties may be linked to prostate issues. This symptom often goes unnoticed as part of a broader health problem, but it warrants thorough evaluation. Consulting a urologist early on can help identify whether the issue stems from prostate cancer or another condition. Early diagnosis also offers opportunities to manage complications more effectively and preserve quality of life. 7. Persistent bladder pressure. A frequent complaint among men with prostate abnormalities is the constant sensation of a full bladder, even after urination. As the prostate enlarges or becomes inflamed, it may partially block the urinary flow, leaving residual urine in the bladder. This causes a sensation of ongoing pelvic pressure and prompts men to strain their abdominal muscles to empty their bladders more completely, often unsuccessfully. This residual pressure can lead to complications, such as recurrent urinary tract infections, UTIs, as the leftover urine becomes a breeding ground for bacteria. Additionally, persistent bladder pressure disrupts daily activities and exacerbates related symptoms like nocturia, frequent nighttime urination. If you notice these symptoms, consulting a specialist for imaging tests and laboratory evaluations is vital to determine the underlying cause and receive proper treatment. 8. Unexplained weight loss. Unintentional weight loss is a hallmark symptom in many cancers, including prostate cancer, particularly in advanced stages. Tumor growth can trigger metabolic changes that cause reduced appetite and muscle mass loss. Sudden and unexplained weight loss often occurs alongside other signs, such as persistent fatigue, pale skin, and overall weakness. While this symptom is more common in aggressive forms of prostate cancer, any rapid change in body weight without a clear cause like dietary changes or increased physical activity should be taken seriously. This condition may also indicate other medical issues, such as hyperthyroidism or gastrointestinal disorders, further emphasizing the importance of seeking a comprehensive medical evaluation. If you notice your clothing becoming looser or significant changes in your appetite and energy levels, consult a healthcare professional promptly. Identifying the root cause early allows for more effective intervention and can potentially address life-threatening conditions before they progress further. 9. Fatigue and persistent tiredness. Persistent fatigue, even during simple routine activities, can arise from a variety of causes. However, in the context of prostate cancer, this constant feeling of exhaustion can signal a deeper problem. As a tumor grows, the body's resources are often redirected toward combating the issue. This diversion of energy, combined with metabolic changes caused by the disease, can lead to poor nutrient absorption and reduced oxygen delivery to tissues, resulting in a constant state of fatigue. This fatigue is not the same as feeling tired after physical exertion. It is unrelenting and doesn't improve with rest. Men who experience a significant drop in energy levels without a clear reason, such as changes in lifestyle, sleep habits, or stress, should seriously consider the possibility of underlying health issues, including problems with the prostate. Fatigue associated with prostate cancer can also lead to a generalized sense of weakness that negatively impacts productivity, mood, and overall quality of life. When coupled with other symptoms like urinary changes, pain, or weight loss, this sign should prompt immediate medical evaluation. Even though fatigue is a non-specific symptom, it is often a critical early indicator of an underlying condition that should not be ignored. The role of routine prostate exams. When it comes to early detection of prostate cancer, two primary diagnostic tools are widely used: the PSA, prostate-specific antigen test, and the digital rectal exam, DRE. PSA test. This simple blood test measures the levels of a protein produced by the prostate. While elevated PSA levels don't always indicate prostate cancer, as they can also result from inflammation or benign conditions, significantly high values often serve as an early warning sign. Digital rectal exam, DRE. This procedure allows a doctor to assess the prostate's texture, size, and shape through touch. It is an invaluable tool for identifying abnormalities that may not be evident in a blood test. In some cases, additional diagnostic tools like a transrectal ultrasound, an MRI, or a biopsy may be necessary to confirm suspicions and gain a more comprehensive understanding of the condition. Routine screening is crucial for men aged 50 and above, or starting at 45 for those with risk factors such as a family history of prostate cancer or being part of a higher-risk ethnic group. These simple exams significantly improve the chances of detecting prostate cancer in its earliest, most treatable stages. What to do after a confirmed diagnosis? If tests and biopsies confirm the presence of malignant cells in the prostate, the next step is to determine the stage of the cancer and plan treatment. Common approaches to managing prostate cancer include: 1. Surgery, radical prostatectomy. This involves removing the prostate gland, often used when the cancer is localized. While highly effective, potential side effects include urinary incontinence and erectile dysfunction. 2. Radiation therapy. This can be delivered externally or internally, brachytherapy, and aims to destroy cancer cells. Side effects may include bladder irritation, rectal discomfort, and fatigue. 3. Hormone therapy. This treatment reduces testosterone levels, which can slow tumor growth. However, it may lead to side effects such as hot flashes, reduced bone density, and changes in libido. 4. Chemotherapy. Typically used in advanced stages when cancer has spread, chemotherapy targets rapidly dividing cancer cells. While effective, it often comes with systemic side effects like nausea, hair loss, and fatigue. The treatment plan will depend on the cancer stage, the patient's age, overall health, and personal preferences. Open communication with a healthcare provider, including seeking a second opinion, ensures the most appropriate and personalized treatment approach. Quality of life during and after treatment. Maintaining quality of life is a vital aspect of the recovery process, particularly when dealing with the physical and emotional challenges of treatment. Several strategies can help patients manage side effects and regain a sense of normalcy. Physical rehabilitation. Supervised exercise programs and pelvic floor physiotherapy can improve strength and reduce issues like incontinence. Nutritional support. A well-balanced diet rich in fruits, vegetables, whole grains, and lean proteins can boost immunity and aid recovery. Avoiding processed foods and excessive fats is also recommended. Emotional support. Prostate cancer can take a significant toll on mental health. Sharing experiences with loved ones or joining support groups can help alleviate feelings of isolation. Professional counseling can also provide tools to manage stress, fear, and anxiety. Facing prostate cancer is a challenging journey, but patients don't have to go through it alone. Engaging with a strong support network and relying on medical experts ensures that physical health, emotional well-being, and quality of life remain priorities during and after treatment. The importance of a balanced diet for prostate health. Numerous studies highlight the significant role of a well-balanced diet in both preventing and managing prostate cancer. A diet rich in fruits, vegetables, legumes, and whole grains provides the body with essential vitamins, minerals, and antioxidants, all of which help neutralize harmful free radicals. Free radicals can damage cells, increasing the risk of cancer development. Nutrient-dense foods like these also support immune function and overall cellular health. Conversely, diets high in fatty red meats, processed meats, and ultra-processed foods can promote chronic inflammation in the body. This inflammatory state may create an environment conducive to the development and progression of malignant cells. The consumption of these unhealthy food options is also linked to obesity, another significant risk factor for prostate cancer. Adopting a Mediterranean-style diet has shown remarkable benefits for prostate health and general well-being. This diet emphasizes foods like fatty fish, olive oil, nuts, seeds, whole grains, and fresh vegetables, which are rich in omega-3 fatty acids and antioxidants. These nutrients have anti-inflammatory properties and contribute to hormone regulation, reducing cancer risks. Additionally, moderate consumption of soy and soy-based products, such as tofu or soy milk, is an area of increasing scientific interest. Soy contains compounds like isoflavones, which may positively influence hormonal metabolism and help protect against prostate cancer. Prevention beyond diet, lifestyle matters. While a healthy diet is crucial, prevention extends beyond what's on the plate. Weight management and regular physical activity are powerful tools in lowering the risk of prostate cancer and other chronic diseases. Exercise enhances immune function, helps regulate insulin levels, and reduces chronic inflammation, key factors in cancer prevention. On the other hand, a sedentary lifestyle contributes to fat accumulation, which can lead to hormonal imbalances and increase the likelihood of mutations that promote tumor growth. Engaging in physical activities that are both enjoyable and sustainable is essential. Exercises like walking, swimming, cycling, or strength training are highly recommended, but these activities should be tailored to an individual's health conditions and guided by a professional when necessary. Moreover, mental health plays a pivotal role in cancer prevention. Prolonged stress and anxiety can elevate inflammation levels and weaken the immune system, creating conditions favorable for tumor progression. Managing stress through mindfulness practices, therapy, or relaxation techniques can help reduce these risks and improve overall health. Breaking taboos around prostate health. Unfortunately, the reluctance of some men to openly discuss intimate health issues remains a significant barrier to early detection of prostate cancer. The digital rectal exam, DRE, for instance, is a quick and critical procedure, yet many men avoid it due to embarrassment or discomfort. However, delaying or avoiding this examination can lead to late-stage diagnoses where treatment becomes more complex and less effective. Early detection dramatically improves treatment success rates and reduces the risk of severe complications. Awareness initiatives like Movember aim to break these cultural taboos and encourage men to prioritize their health. Talking openly with family, friends, and healthcare professionals about potential symptoms and routine screenings can lead to earlier detection and better outcomes. Participating in these campaigns or even just spreading awareness within your social circles can save lives. Vigilance and hope. During and after treatment. For men undergoing treatment or in remission, ongoing vigilance is crucial to ensure any potential recurrence is detected early. Regular checkups, periodic PSA tests, and imaging scans are vital components of the follow-up process. While these can cause anxiety, they serve as essential tools for timely intervention if any changes arise. Thanks to medical advancements, prostate cancer cure rates have become increasingly promising, particularly when the disease is detected early. Innovations in surgery, radiation therapy, and hormonal treatments continue to improve outcomes and minimize side effects. For those with a family history of prostate cancer or experiencing unusual symptoms, seeking help without delay is essential. Knowledge, combined with routine screenings and a proactive mindset, is the most powerful ally in combating prostate cancer confidently and effectively. This information is grounded in credible medical research, but does not substitute for professional healthcare advice. If you notice any concerning symptoms or have questions about your health, consult a qualified healthcare provider. Early detection and appropriate treatment are the best ways to protect your health and improve outcomes in the fight against prostate cancer.